Let's talk about radiation safety today. This is regarding the cancer therapy. As we know, if somebody has a cancer, we use radiation therapy, chemotherapy, and a surgery. So these are the three things we use. Radiations can be internal or external. The problem with the radiation is if person is getting radiation, the person who is the technician who is giving radiation has to be careful, because if we get the radiations, the chances are we can also get cancer, right? So if we talk about radiation, people can have implants inside the body. Let's say if somebody has a cervical cancer, so many times what they do, if it is a localized cancer, it hasn't spread yet, so they put an implant inside, and that implant continuously emit radiations which kills the tumor in a cervical area. If that the case, in that case we keep that person under a radiation isolation. It means when we are taking care of that person as a nurse, we need to keep in mind three factors: time, distance, and shielding. So, the fundamental principle of radiation is the radiation exposure should be maintained as low as reasonably achievable. So, make sure your exposure to the radiation is as low as possible. You don't want to compromise the nursing care, but you really want to also make sure you don't get radiation, right? So we have to maintain a balance between that. So if you keep these three things in mind, then I think that will help you a lot. Let's say the time, spend less time with the patient. I'm not saying don't spend any time, spend whatever is needed. If you have to finish the procedure, finish procedure and come back. So spend less time. Maintain a distance. Don't just stand very near to the patient. As much as distance you can maintain. So it depends. If you're doing some procedure, try to be, far as much as you can. But you still have to do what you have to do. Shielding, it means you have make sure you're using lead apron whenever it's needed. We should have a lead container near the patient's bed, so in case the implant comes out, you put it in that. When the implant comes out or it's on the floor, let's say it slips on the floor, then you have to maintain a distance. So for that, you take a big long forceps and hold it and put it in the container. Okay, so always keep those three things in your mind: time, distance, and shielding. Okay, so I'll stop here.